Hi, my name's Kelsey. I want to talk about a couple of issues. Firstly, I want to talk about why it's important to have good deaf awareness. I think it's really important to improve deaf awareness in hospitals, with GPs, at any venues linked to medical issues, because it gives deaf people better access to healthcare, because it means they can communicate with people and it gives them the support that they need. Secondly, I'm going to talk about bad experiences that I've had before. So I'm going to choose one to share with you that's quite important. It was at the time of coronavirus, so 2020, 2021, around that time. I had something wrong with me physically, and I asked my mum if she could contact the GP to make an appointment just to check I was okay. And I said, please book an interpreter before I get there. So they said that was fine, they'd book an interpreter, and I was happy with that. But then a few days later, I went to the GP and I asked the doctor where the interpreter was, and they said, oh, I'm sorry, we can't provide an interpreter because we're only allowed a maximum of 2 or 3 people in the room. And my mum was with me at that time because I had quite bad anxiety, so mum was accompanying me places. So when I asked where the interpreter was, they said we can't provide it because the room's too small to have that many people in, and actually it was quite a big room. So I said, you know, I do have a right to have an interpreter because I need to know what's wrong with my own body. If it's something serious, I need to know that. And my mum can sign a little bit, but she's not fully fluent in sign language. She doesn't do proper British Sign Language, so it made it quite difficult for me to be able to understand the doctor going through my mum. And I had a lot of questions to ask the doctor, which I had to ask my mum, who would then ask the doctor, but she wasn't signing it fully clearly to me. And also I asked the doctor if he could remove his mask so that I could lip read him, and he refused because he said, I don't want to catch coronavirus. And I said, but I've just tested clear, I've just tested negative for coronavirus. So it made it a really stressful situation for me because I couldn't lip read the doctor, I couldn't understand what he was saying. So it made it really hard for me. And my mum and the doctor were talking to each other without fully explaining to me what was being said. So afterwards she gave me a version of what was said, but I feel like I didn't get the full translation of what was happening because it made it really stressful for me. So I didn't know if there was anything wrong with me or if I was ill. But thank you for watching. Bye bye.